Cynthia Shundle, and I serve as co-chair of the Social Work Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic media. Andrea Perdomo Morales.
Present.
Donna Honer-Quayle.
Present.
Sarah Behrens.
Present.
Jasmine Cohen-Young. We understand she's will not be able to join us today. Mary Gill. Mike Gillette. So absent. Leanne Gingery. Yolando Johnson.
Present.
Catherine Reck. Christy Sanders.
Present.
Thank you. Eric Schonecker.
Present.
And Robin Unruh. Okay. Well, we have a quorum. I note the following BSRB staff members are also present: David Fye and Leslie Allen. And next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Cynthia. And it looks like Mike Gillette is attempting to log into the meeting. He may be having some technical issues, but
Okay.
I do see his screen here, so he is present as well.
Oh, I see it too. Yes. Okay. Thank you.
This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the advisory committee, or allows the public to address the advisory committee about their concerns, but the Kansas Open Meeting Act, or COMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment, as no individuals requested to provide public comment at this meeting. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the COMA are not suspended, and we will be conducting this meeting pursuant to the COMA. On August 22nd, 2024, we sent notice of the advisory committee meeting to all individuals who had requested notice of such meeting. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material have been posted on the board's website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye with the subject at ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of this meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And the conference call line is active. I did check it before we got started. There's no one currently on the line, but if I hear someone beep over, I will let you know.
Okay. Thank you, David. All right. Well, our first order of business today will be approval of the agenda. Did you all receive a copy of that in your email?
Yes.
Anybody have any additions? If not, I'd entertain a motion to adopt the agenda as presented.
I second.
Okay, we have a motion and a second. All in favor, aye. Aye.
Aye.
Any opposed? Okay, great. Agenda passes. Okay, approval of minutes is our next order of business from the previous meeting. Did you all have a chance to read those draft minutes that came in the email as well? Are there any corrections or additions or deletions to the minutes as presented? Okay, then I would entertain a motion to adopt the minutes as presented.
So moved.
Thank you. Second. Great. We have a motion and a second. All in favor, aye.
Aye.
Any opposed? Great. Sounds like we have consensus on that. So next, we're going to hear from David and the executive director's report.
Thank you, Cynthia. Just trying to make a couple updates in terms of BSRB operations. One note I want to make people aware of, we have been broadcasting our meetings on YouTube as an advisory committee. Also, the board meetings and the other advisory committees are broadcast, and we've started doing that back in January of 2021. Currently, we are sitting between all of the different broadcasts that we have either done live or uploaded afterwards. We are now at about 9,998 views. So we are almost crossed over into 10,000. Really excited about that, but this has been an excellent way to really help the members of the public, students, licensees be more aware of the work the board is doing, the advisory committees, these discussions. You've had a number of really good speakers that have come in and provided information too. So kind of wanted to give you some feedback. In terms of, our meetings, we're getting probably an average of about 40 people watching those meetings either live or after the fact. For the board meetings, those are averaging about 80 people either live or after the fact. So that number has been building, and I would expect that it will continue to build as we make people continually aware of the work of the advisory committee. In terms of another operations update, and this is also under the topic of outreach, we had a couple of recent informational forums. So last year, as a way to sort of increase our conversations with individuals throughout the state, make them aware of the work the BSRB is doing, and provide a forum for them to ask questions, provide input for the work the board is doing, we set up 2 informational forums, one specifically targeted for educators at programs in the state of Kansas for the professions that we regulate. And we also had a second day that was targeted specifically at employers of mental health professionals, primarily that employed the licensees that we license. And so it was a success last year. We had about maybe 30 to 35 individuals attend each of those last year. The feedback that I received afterwards was very positive. So we decided to do that again. And those forums were held on September 26th for educators and September 27th for employers. We are still working on increasing our list of individuals for both of those. So we're hoping to have even more people attend those forums next year, but the numbers did increase in terms of the individuals who had requested or received the invitation for those forums. We had about 40 people for the educator meeting, and then roughly close to 60 for the employer forum. And so those are not official meetings of the board. They're really put on by BSRB staff as a service. So what we did is we had those over Zoom, recorded the meetings, and then uploaded them to the YouTube channel after the fact. So anyone can go and watch those forums. They are very similar. So if you're going back and looking at one of the other, the content will be very similar, but a little bit different based on the 2 different groups of individuals involved. I did see that Leanne Gendry entered the meeting, so she is present as well. And then in terms of my report, I'll switch next from outreach to talking a little bit about updates from the most recent board meeting. And so generally the board meets every other month, and the advisory committees meet every other month on the off month. And so there's a rotation each month of either a board meeting or the advisory committees meet to discuss items. This is an unusual month that we just finished in September because the board likes to have an annual in-person all-day planning meeting once a year to talk about items relevant to the legislative agenda or topics that require more in-depth discussion. And so this is an in-person only meeting. It does move around the state. 2 years ago, it was in Kansas City. Last year, it was in Wichita. This year, it was in Lawrence. And it was open to the public. We did have a couple of public attendees that attended the first day of the meetings on Sunday. The board did a number of different, a lot of work over the weekend. I just wanted to report on some of those topics from the board meeting that we had yesterday and the day before. So there was some public comment that had been submitted in written form for an individual concerning the licensing test for psychologists, the EPPP. And that was by Dr. Krista Edwards. There were the regular business items that we would see, such as review of the previous minutes, executive director's report, the professions reports, and the plan review committee report. And then we started talking about a number of different topics. One of the topics that was mentioned had to do with expectations for advisory committee members. And so, as you may recall, when you were asked to serve on the advisory committee, you were given a copy of the policy. It's a fairly short policy, and there is some language in the policy that says the policies and procedures that relate to board members should also be expected from advisory committee members. However, that's not always the case. And so there are certain differences based on the fact that board members are appointed by the governor, advisory committee members are appointed by the board and really are under the authority of the board. And there's some other differences too. And so there has been some questions over the years concerning, should advisory committee members need to live in the state of Kansas? Do they need to be licensees? Some other questions like that, absences, that kind of thing. And so the board had a discussion about expectations. The board did come to some conclusions and some recommendations for changes to the advisory committee policy. So we will be drafting those and bringing them back towards the board. And then once the board confirms those in the policy, we'll be sharing those with the advisory committee. But it should help clarify some of the questions that have come up over the past few years. There were a number of individuals that were appointed to different advisory committees, including the Addiction Counseling Advisory Committee, the Behavior Analyst Advisory Committee, and the Licensed Psychology Advisory Committee. I believe, if I'm not incorrect, that either 6 or all 7 of the advisory committees added new members over the last few months. And so we appreciate all the interest from applicants. There are only, according to the policy, there's a limit on how many people can serve as a non-board member on the advisory committee. It does say that there's a minimum of 3 non-board members and a maximum of 10. And so once you hit that maximum, there's no space to add additional members, but the terms are staggered. So as people will end their service, there'll be more opportunities in the future for advisory committee members to serve. But thankfully, we've had a number of people apply for those positions, and appreciate all the work that you all do and your role on the advisory committee. So the advisory committees are really a successful tool. I've had some questions about the advisory committee recently from some representatives of different associations at the national level, kind of trying to figure out why things are working effectively in Kansas. And there have been a couple of states that have passed structural changes recently that really kind of seem very familiar to me. Iowa made some changes where they went ahead and made a composite board, and they were lining up a structure that looked a lot like the advisory committees, so that there would be a standing committee for each one of the professions. Utah also did something similar to that recently, where they put together a composite board, and I've received some questions from both of the individuals who work for those 2 states. So it's nice to see that the model here is working well, so I just wanted to share that with you all. In terms of some other items for the advisory committee, so the social work multi-state compact passed in Kansas earlier this year. There are now enough states for the compact commissioners to begin to meet. Every state was asked to name a commissioner for their state, and so the board did name me as the compact commissioner for the state of Kansas. At the board meeting over the weekend, the board was able to name a backup commissioner. That is something that some of the multi-state compacts do allow, and have someone that is able to serve if the commissioner is unavailable. And so the board selected Andrea Perdomo Morales to be the backup commissioner for the social work compact for the state of Kansas. So I want to thank her for her willingness to serve in that role. The compact is a really important thing, and we're kind of taking the first steps towards helping it become operational. So looking forward to kind of working more on that topic. However, in terms of the roles that I play for the board, I have been currently serving as the commissioner for the SPIPAC compact, and that is for the psychology multi-state compact. And I will be stepping out of that role. That compact is fully functional. It's been operating now for a few years. And just to make sure that, give board members the opportunity to serve in different roles. And, in terms of my different roles, I don't want to stretch myself too thin too. And so I am stepping out of that role, and Richard Noble, the psychologist, one of the psychologists on the board, has volunteered to serve in that capacity as the new commissioner for the SIPAC Commission. So I'll be switching that over to Richard. There is an annual meeting coming up in November, and he's not able to attend that meeting. So the transition of that change in compact commissioner will take place after that meeting in November. In terms of some other items, the board did review some recommendations from the different advisory committees that had been forwarded. For the Licensed Psychology Committee, there was a recommendation by both Licensed Psychology Advisory Committee and also the Master's Level Psychology Advisory Committee to support a proposed bylaw amendment from the Psychology Licensing Board in Texas. This would be a bylaw amendment to the bylaws for the Association of State and Provincial Psychology Boards, ASPPB. That is the entity that has creates and administers the test for psychologists. They recently had come out with an announcement. They are going to add a new part of the test that is been treated basically as a separate test previously, but they would like to require this for all states beginning January 1st of 2026. The proposed bylaw amendment from Texas would allow states the ability to choose whether or not they would like to make this mandatory as a condition of licensure. So the board did vote to support the proposed bylaw amendment so if that does pass, the states will have the ability to either accept the EPPP2 to pass, basically they can continue to use the EPPP as a licensing examination. And if they would like to require the EPPP2, that's a choice that each state can make. But if the bylaw amendment passes, it won't be a mandatory requirement as it's scheduled to be right now, coming up in 2026. There was a recommendation by the Behavior Analyst Advisory Committee to ask for legislation for there to be a board member for behavior analysis. When that profession was added under the BSRB, previously, when the board was originally formed, they took the existing bodies for psychologists and also social work and put them together. And then there were public members that were added. And then as the different professions have come under the jurisdiction of the board, since that point, they have added an individual from each of those professions, and the board makeup has increased. When they added behavior analysis, there was not a change in the statute to add a board member for that profession, but it has been one of the fastest growing professions over that time. And it is getting close to about 400 to 500 licensees. And so that was one of the recommendations from the advisory committee would be to add a board member specifically for behavior analysts. And the board did vote to support that recommendation. And so that is something the board we were requesting as a statutory change coming up this year or next year. There was also a recommendation that had been forwarded concerning some language in the addiction counseling statute construction of act. It is KSA 65-6616. The language here relates to individuals that are able to practice without an official license, and there is a very limited number of carve-outs to allow individuals to provide services without being licensed. And in the language of the section, it talks about individuals who are students or interns. And so under those circumstances, individuals are able to provide certain services without having a full license while they're a student or intern. But there was some general language that said, or individuals preparing for the practice of addiction counseling. And there was not a definition of preparing for practice or preparing for the practice. And in researching that item, we couldn't find any really good information on what that was specifically targeted for a group to be able to practice under that. And so the board was asked to either remove that language from the statute or to add a definition of a different group that would be related to. And it seems like the easiest way to kind of handle that issue currently, since no groups have been identified that would really fall under that category, would be to go ahead and remove that from statute. So the board did vote to support that for the addiction counseling profession. There is similar language for the marriage and family therapy profession in statute, and that's going to be referred to the Marriage and Family Therapy Advisory Committee for discussion, and probably the board will follow up on that item in November concerning whether or not to strike that from the statute for marriage and family therapy. And then in terms of the last recommendation that had been forwarded to the board, that had to do with some proposed changes to the student temporary licensed addiction counselor license. This is a license that was started by the board last year. It was something the board had put forward as a method to help with workforce development. It's sort of a pipeline as students are going through the process, working towards a 4-year bachelor's degree. So these would be individuals who have about 60 credit hours with an emphasis in addiction counseling or a related field. They would have to meet other requirements and work in certain facilities under supervision. But they would be able to work for a couple years under the student temporary license. And then if they got their permanent license, it would transition to the permanent license. And so there were some small adjustments that were recommended by the board to this. One would be for people who have already graduated from a bachelor's level program and are now in a specific addiction type program. So they are pursuing an addiction program, but they've already received their bachelor's degree. So they have more than the 60 hours. And so the board thought this would be helpful to kind of broaden the classes of people that would qualify for this student temporary license. And so we're drafting some language to bring back to the board on that topic, but that would be something that would need to be put forward in legislation. The original context for the student temporary license was put in statutes. This would need to be an adjustment to the law. Some other items, there were some updates on BSRB operations, and we're working on trying to come out with an official report. We can summarize some of this information, but one of the trends that I was able to inform the board about is that in looking at our licensing numbers, looking back from fiscal year 22 to 23 to 24, our processing timeframes have decreased each of those years. The length of time for certain applicants is getting shorter. And I think part of that is to do with we were able to hire some additional staff members. We're also working on some efficiencies in terms of our processes. In the future, the board has voted for us to move to the Acela licensing platform, and we expect to receive even more efficiencies when we're part of that platform. It'll integrate a lot of our functionalities that right now are separate and we have to kind of tie together. But we also walked through the process by which individuals go through to become licensed. There's a few different paths. And it was helpful, I think, for board members to be able to see some of those different parts along the path. There are certain timeframes that are outside of the BSRB's control. For example, someone still needs to pass the licensing examination. We open up a window of time for them to do so, but scheduling that, taking that, and passing that is up to the applicant. And then once the applicant, if they do pass the test, there is a certain amount of time based on those providers for us to actually get those scores reported back to us. And then there's things like reporting of transcripts and getting references, and there's a lot of different elements. And so to make sure that board members could have a good understanding of this, we provided a couple of documents that kind of showed a path. And I think those were met with a lot of positive support. So we're going to be putting that information, that information is already on the website, but we're going to have that information cleaned up a little bit more and then put it in the licensing section of the website so that future applicants can kind of see the path a little bit cleaner too. In terms of some other items from that board meeting, there was continued discussion on supervision requirements for professional counselors and marriage and family therapists. That topic was referred back to the advisory committees for some further discussion, but I think it is possible that based on the discussions of those advisory committees and recommendations, that could be a topic the board revisits in the statutory change coming up next year. We also talked about a process for expedited application review and trying to put something into place to help people have that option too. And so that is a process that we are building from scratch. But I think we now have a pretty good direction based on the conversation at that meeting. And we'll be kind of moving forward, trying to put together some language for the board to review at the November board meeting on that. In terms of some other topics, there is a regulation that is out for public comment in Texas that would allow their licensing boards some flexibility in terms of being able to remediate a deficiency when an applicant applies for licensure. And so the board reviewed that language, and I think there was some support for something similar to what Texas is offering. The goal in mind would be that this regulation would not it would not be able to solve issues related to the statutory requirements. The statute does have authority higher than the regulation, but if there was a small regulatory issue where someone was deficient in one of the requirements for licensure in the regulation, this regulation that deals with remediation would provide the board more flexibility to be able to figure out what would be an alternative for that person to satisfy in certain situations so that we could license more people. So give the board more tools for trying to figure out what would be a good thing for help people get licensed. There was also a discussion about reviewing academic programs independent of a licensed applicant. Right now, the way that our statutes and regulations are written, it is through the lens of someone applying to the BSRB as an applicant for licensure. And so we don't have authority to tell schools or programs what they need to require. We have the statutes and regulations that show what is necessary for licensure. And if schools want their tracks to meet the requirements for licensure, they need to design them to match what's in the statute and regulation. However, we do occasionally get requests from schools that say, can you review my program to verify if my program meets the requirements for licensure? Well, that's really not something that we are built to do. We're really built to work through the lens of the applicant, not through the lens of the school. And in fact, for us to take the staff time to do that review of a program, there's no way for the BSRB to be compensated for that use of staff time. So we presented a proposal to the board similar to what I think Missouri is utilizing that would allow an individual or a representative from a school to be able to request a review of their program independent of an application for licensure. And that would allow the BSRB to do that review for a small fee. And then we would be able to provide that to them. So we can see some benefit here with the assurance that those people would have for their program. It would be optional. They can still do what they're currently doing by reviewing the statutes and regulations and coming to their own conclusion. But this would be at least a way that it would be a way that we can be mindful of how we're using staff time in this resource, but also making sure that we're helping out those schools in Kansas when they do have questions about whether they meet the requirements for licensure. There was also some discussion about pre-approved continuing education for other providers. We're getting close to launching our agreement working with CE Broker. When individuals renew their license, we audit 10% of those individuals. And so as we are moving under the CE Broker system, by which individuals or licensees would have the choice to go ahead and upload their documentation that shows they've completed all of their CEs. Social work right now is the only profession that has requested, and we have authority to have pre-approved providers for continuing education courses, and also to have a pre-approved specific course that the BSRB would hold out as meeting the requirement. The other professions had not requested this in the past, but we thought this might be a nice thing we could offer for the other professions, is to have similar statutes. It would not be mandatory, but if any CE providers wanted to have that designation, they could go ahead and have that. The board was supportive of that. We're going to be drafting up some statutory language and regulatory language if necessary, and bring it back to the board so they can take a look at that for the different professions too. And then let's see, there was a discussion about a possible student temporary license for graduate level students, but that item is still being reviewed by the Addiction Counseling Advisory Committee. So there might be more discussion for that advisory committee and then ultimately by the board. And then there was a discussion on BSRB fees. Back in 2019, the board made a decision to significantly lower application fees and renewal fees, and those were decreased pretty significantly. Since that time, we have tried to maintain those decreases without having to revisit our fee structure and consider increasing fees. And I'm happy to report that since that time, while the fee fund balance has gone down over the last few years, we are still at a healthy enough position that the board could have conversations about looking at other possible fee decreases that we would at least be able to put in place for the next few years. And so one topic the board was looking at were the different types of fees charged by the BSRB. And the one fee that they were talking about specifically was the original license fee. So when individuals apply for licensure, they pay the application fee. And then if they pass their licensing examination and meet all the other requirements for licensure, at that point, they have to pay an original license fee. And that fee basically provides operating income for the BSRB to basically assist them for the first 2 years that they are licensed, and then to do the investigation if they have any kind of complaints against them during that time period too. And so what the board recommended at the meeting was for all the professions that have an original license fee to go ahead and lower that fee by $50 for each of the professions. For licensed psychology, their fee structure is set up a little bit different, but it would be a $50 decrease from their application fee. But for all those professions, there would be $50 off the original license fee. And so that'll be a change the board will be pursuing the rules and regulation process, but really happy to announce that. We will monitor our fee balance. And so if we do come to a position where we are concerned about the balance in the BSRB fee fund dropping too quickly, we will take appropriate action. But I think, and the board had a good conversation about this. I think this is a change that we can make. And I think it'll be helpful for individuals when they're starting their work in the profession. So just happy to share that. So with that, I think I will go ahead and end my report and see if there's any questions over BSRB operations or items from the recent board meeting that just took place yesterday and the day before.
David, maybe I missed you talking about the recommendation that this advisory committee made.
You are correct, and I'm sorry about that. I think I just skipped over it when I was going through different items. Yeah, my apologies about that.
No worries.
One of the recommendations from this advisory committee that was brought to the board, there were two recommendations. One had to do with changes in law last year for individuals attempting to meet the requirements for the licensed specialist clinical social work license. For the professions that are practicing at the clinical level, there is some requirements in the statutes that talk about having to pass a certain number of courses and get a certain amount of experience that's really focused on being able to diagnose and treat. And that is because ultimately when the individuals finish all of the hours they need and have all of the supervision that is required and then pass the relevant tests, they would be able to diagnose and treat independently. Well, last year with the legislature for the social work profession, there was a change to the statute that struck 4 of the 5 classes that were specifically required in the statute. Psychopathology was the only one that was left from that section of the statute for 3 hours. Also, the previous language that had talked about the certain number of the hours being diagnosing and treating, the language was modified to say that the hours would include, but be not limited to, diagnosing and treating. And so there were concerns by the advisory committee. That recommendation was put forward to reverse that language for the individual seeking the clinical license. And so that was something the board, that was forwarded to the board. There was also the recommendation to create a new level of license. This would be an advanced generalist type of license for individuals that would be practicing independently, but would not be able to diagnose and treat because of the difference between the different license types. And so ultimately with the board, had a good conversation about this topic, and we are currently in the process of reaching out to representatives from NASW Kansas. As much as possible, we would like to be able to work together on items for legislative consideration. And so that item was tabled by the board to allow us the opportunity to meet with representatives from NASW Kansas to discuss these topics, to see if there is common ground that we can work with. in terms of these topics, and then to come back to the board at the November board meeting. So right now, that's where we're at. The topic has been tabled, and we will try to set up a meeting between now and the next board meeting, which will take place in November.
So most of you were aware of that recommendation, but just to recap, the language of including but not limited to would allow people that did not have 1,500 hours of clinical training to become licensed as an LSCSW, and that would make, and we would be the only independently licensed clinicians that are not required to have 1,500 hours of clinical training in order to get that license. So that was why, that was our concern about wanting to get that language reversed, and the idea of creating another specialist license for those who want to have a specialist license but don't want or don't have the clinical hours. That was a way to balance that, because that was what the people who were who put forth that amendment last year were saying, that there are a lot of LSCSWs that don't practice clinically, which is true, but they can, is the point. They are authorized to diagnose and treat mental disorders, and they need to be trained equivalently to every other mental health professional who has that privilege. So that was the rationale behind that request. So we'll see. Hopefully we can have some good discussions with NASW Kansas, because they were behind that amendment that was put forth last year. A couple of other comments on what David said. The educator and employer forums, I think I would encourage you to go in and listen or watch the YouTube recording of those forums. I think it's so important for the board to be reaching out in that way. As we went through those, the step-by-step of how people get licensed, there are many checkpoint or choke points along the way, which the board cannot do anything about, and it really starts at the education level when they're in school. There needs to be, more, I think, education and understanding of the students about what's going to be required. And then also the issue that David mentioned about programs that are not accredited and have to go through the assessment on behalf of the client, I'm sorry, on behalf of the student, the applicant. That's a big choke point. And if educators are aware that, that's for their students to be licensed, those processes need to be expedited at their end, because the board can't do anything about getting those transcripts or getting the information they need in order to assess that program. So I think those both, and on the employer forum, it's really important that employers know that the board is very tuned into workforce shortage and trying to come up with many different ways to alleviate that problem. But we need to hear from the employers about what they're needing in order to come up with more opportunities to help them find competent social workers. Oh, I already said that. Okay. Oh, yeah. And just another point about the program review that we voted to offer to schools so that they could have their program evaluated and be able to tell their students, yes, our program will get you licensed. That's going to be good for 1 year, because we know that programs change regularly. And so they would have to redo that every year if they wanted to be able to have that assurance that their program passed muster for licensure purposes. So any other comments or questions about our 2-day meeting? It was very productive, I think. We covered a lot of ground, so Okay, well, moving on to old business, continued discussion on adding a description of each profession to the BSRB website in order to help the public understand the differences between the professions. So we did assign 3 different levels last time we met, and a bachelor's level, master's level, and clinical, and then DSW PhD level. So was it Catherine that was going to do the bachelor's level one? And you said she sent,
Yes, she sent that information to me. She had volunteered to take a shot at a draft for that level of license. So I can go ahead and read what she sent to me, kind of as a starting point, if that would be helpful.
yeah, you don't have a ability to share a screen where we can see it?
Yeah, let me do that actually. It is sometimes really helpful to see it on print. So I'm sharing my screen now with some of the language for the LBSW license. Okay. So the language that she had provided to me is that she said in Kansas, an individual who is licensed in social work at the bachelor's level, LBSW, is qualified to work in various settings, such as state agencies, medical facilities, and community organizations, assisting individuals and families facing a wide variety of challenges. And LBSW has the training and education to provide case management services by assisting clients for service needs, making referrals, and monitoring clients using a holistic approach, focusing on the client's overall well-being. Additionally, LBSWs engage in community outreach and advocacy efforts to improve access to social services and promote community health.
That looks good. What does anybody think about any additions or any changes in the language on this definition?
This is Lee. That sounds good to me.
Is there anything we think is that bachelor's level social workers do or can do that isn't included in this description?
At the technical aspect, I didn't see any language that talks about being able to practice independently or needing to practice under the supervision or direction of someone, but that is something that might be helpful for members of the public to let them know this is not a level of license that can practice independently. But that's more of a technical kind of thing.
So maybe a sentence that LBSWs would be working under supervision. I guess there could be a private practice situation that might employ LBSWs at some level. I don't know of any.
This is Leslie.
Yeah.
There are the LBSWs who work for nursing homes that go to different nursing homes, and they're not considered, I guess their contracts, they're considered private, or the statute for social work only refers to under direction for those working, diagnosing, and treating. For LMSWs who are diagnosing and treating.
They're the only ones that have to be supervised.
Or an LMSW in private practice.
Right.
So, yeah. So really, there's nowhere that says an LBSW can't have a private practice, but they can't have a clinical practice.
So they wouldn't, there wouldn't be anything in there about diagnosing and treating, David, because they're not licensed to do so. But they are, so you're saying they can practice independently on the nursing home assessments?
You have any recommended language, Leslie, to help kind of clarify that point?
I guess, really clarifying language would be that they aren't authorized to diagnose and treat mental health disorders.
Right, at the bachelor's level.
Mental health disorders.
But do we want a sentence in there about the usual, well, she gives some examples of community settings in which bachelor's level people work. Just something about that they usually work in agencies. But you're saying that there could be a LBSW could have a private practice doing contract work for nursing homes.
Mhm.
Is that the only
I don't
service?
know. I just know that's one that's come up.
Okay,
I think you probably could also be in private practice doing case management. I don't know that that necessarily is diagnosing and treating either.
no, it isn't. But yeah, I get you could have a private practice doing that. So do we want to include any statement about private practice versus agency work, or just note that they're not authorized to diagnose and treat mental health disorders?
I think just noting the not diagnosing and treating is probably sufficient. I think when you get into the prospect of trying to figure out typical job duties or what you might see, I think that
Mhm.
falls back on the agency or the situation and not something
Mhm.
the board necessarily needs to um, articulate.
Yeah, the assessing clients for service needs, the nursing home work would fall under that general description.
Right. I don't see where, I think just putting it, they can't diagnose is the best way. That way it's covers it all, it envelopes it all.
Okay. Any other thoughts, comments, additions, deletions? Okay, that's great. And then the master's level.
I had that one. David, I did just send it to you, but I also can share my screen if you would prefer.
Okay, yeah, why don't you go ahead and share your
That'd be great.
screen and we can take a look at it.
I'm gonna make sure this is big enough though. Okay. Should I make it bigger? Is that big enough?
I think that looks good to me. Everyone else, can you read that okay? Okay. So it looks like a licensed master social worker can perform all the responsibilities of a licensed bachelor social worker, as well as the additional responsibilities of conducting clinical assessments, diagnosing mental health disorders, developing treatment plans, and providing individual, family, and group psychotherapy under the supervision of a licensed specialist clinical social worker or medical director. The settings in which they may practice also expand to schools, healthcare, and administration, which are not always options for the licensed bachelor social worker. Being a licensed master social worker also provides an individual with an advantage when competing with a licensed bachelor social worker for job opportunities.
They can provide psychotherapy under the supervision of an LSCSW or any clinically licensed person at the BSRB. Unless they're in a private practice. We have to make it difficult.
So instead of you're thinking we should add other clinically or other mental health professional licensed to practice independently.
Yes.
Do we add that to medical director? Or
I would say under the supervision or direction of an LSCSW or other independently licensed person at the BSRB or a medical director.
So all three of those categories. So like LSCSW, comma, other licensed mental or other licensee of the BSRB who is licensed, this is clunky, who's licensed to practice independently, or a medical director.
And And I'm sorry, so I'm not familiar. Does a medical director, is that an MD? It has to be a medical doctor or licensed, our statute says licensed to practice surgery, which really isn't helpful.
I'm just going off of like places I've worked before and they hired medical directors, but they may have been psychiatrists. I just know
So
that job.
if we just say MD,
Yeah,
then
that's what I think.
because the psychiatrist is an MD and a medical director should be an MD, but I know they may hire medical directors that have more of a business background in some organizations. So MD would, or medical doctor would.
I would propose just putting independently licensed, because I do think some MDs can be, I could be wrong, but could be nurse practitioners, because in Kansas, they can practice independently.
But
Nurse practitioners can't. They have to have a doctor overriding them. They pay for supervision essentially of a doctor of some kind.
Mhm.
I think if you're an APRN, you can practice. I don't know. Anyways, I don't want to go down that rabbit hole because I can't say 1,000% sure.
And I don't know if APRN would be covered in the statute, Leslie.
no, we don't include that. APRNs, we just say independently licensed or an MD.
Or an MD. And yeah, I don't think APRNs are officially MDs, even though they have more independent privileges.
I know that if they write prescriptions, a psychiatrist's name is also on the bottle.
Yeah, they have to prescribe under supervision. I'm not sure what that looks like other than
Right.
the psychiatrist signing his or her name, but
Right.
but it's there. They're technically covered.
So is anybody capturing that or do I need to update this? I need to add in that.
Yeah.
I'm not sure how to word that.
Dave, we can do that. If you have a copy of it, we can just add that later.
Okay.
Okay.
And I wonder if we want, it's true that being an LMSW may provide you with an advantage over an LBSW, but I don't know if we want to know that.
It's not really a job responsibility. It was just, and FYI.
It's
Yeah.
it is the truth, but yeah, if we're looking at giving a description to the public, then that's probably less relevant.
Yeah. So just take that
About
sentence off.
what LMSWs do. So yeah, Leslie, you and David can add that language that will define more clearly who they can be supervised by.
And take the last sentence off.
Okay.
Take the last sentence off. And then probably after the first reference of a licensed master's social worker, we'll just have LMSW. That way they can help them
streamline it.
Acronyms too. Yeah. And in that section that talks about supervision, we can also add what Leslie had mentioned as far as or direction, because that is part of it too.
Yeah. Okay.
But thank you for writing that up. It was really helpful and it's a good summary.
Yeah, definitely. Well, I had the MSW, or I'm sorry, the LSCSW, and if I can share my screen.
I think you should be able to.
There. Okay. Can you all see that?
Not yet.
Not yet. Okay, let me come back here. Where's the share? Oh, here, share. There it is. Okay.
We can see it now.
Yeah, can you all see it?
Yes.
So I'll just read it. Clinical social work is a specialty practice area of social work which focuses on the assessment, diagnosis, treatment, and prevention of mental illness, emotional, and other behavioral disturbances. Individual, group, and family therapy are common treatment modalities that, and up to that point, that is the NASW definition of clinical social work. And then I added, in Kansas, an MSW may practice clinical social work under supervision of an LSCSW. A specialist clinical social worker is authorized to practice independently. And then, I thought it was important because one of the reasons we wanted to have these definitions was so people would have some idea of the maybe the philosophical difference or the orientational difference of the different disciplines. So I added this paragraph: social work as a discipline is defined by a person and environment understanding of human difficulties. In other words, whatever problem a client may present, there are likely to be contributing factors within themselves, such as stress or mental illness, and also around them, such as cultural beliefs or societal discrimination. A clinical social worker will assist a client in identifying these factors and ways to address them, which may include psychotherapy, self-advocacy, or social activism, among others. I think that's pretty fundamental difference between social work and the other licensed professions under the BSRB. And clinical social workers perform services in a variety of settings, including all the private practice hospitals, community mental health schools, correctional facilities, primary care, and agencies. And then, I don't know very much about DSW and PhD level practice because there's not a separate licensure, but they may practice as clinicians if they are so licensed, and they usually do social work research and or teach at the university level. So I would like to hear if any of you have other things you think should be added to this section about DSW PhD social workers, or any additions, deletions, amendments on the LSCSW definition.
I had a thought in the seventh line where it talks about in Kansas MSWs may practice under. I think changing that to in Kansas LSCSWs may supervise the practice of MSWs or LBSWs. I think more puts it towards what the LSCSW can do. And I think clarifies that a
Okay,
little bit.
switch that around.
Yeah, I agree. This is Lee. I agree. It would clarify.
I think the paragraph you have where the social work as a discipline is defined by person, I think that first paragraph, where it ends at discrimination, should be something at the beginning of each, or at the just before each, not just the LSCSW.
Oh, about the what defines a discipline, that paragraph?
Yes.
That could be yeah, maybe that could just be at the beginning and then have the different
Yes.
levels. Because yeah, you're right, the other two didn't really talk about what defines social work as different from the other professions. Let me see if I can finish. Let's see. In Kansas, an LCSW may supervise the clinical practice of an MSW. Is that what you were thinking, Eric?
Yep.
Or MSW.
Does that cover it?
And Cynthia, probably one technical thing, I would add an L before the MSW. Because
yes, because they have to be licensed to practice.
there can be a little confusion sometimes with people who have the degree but are not licensed. So we want to make sure.
Yeah, good point. Let's see.
One thing that's also just incredibly technical and picky, but the first time you use LSCSW, you should spell it out, not use the LSCSW. So where it says specialist clinical social worker right below it,
Oh.
spell or pull that up and then put LSCSW in parentheses, and then you can use LSCSW through the rest of the thing.
Okay, so. Is that what you were thinking, Eric?
Yes, ma'am.
Thank you. You've got the style book down from all of your editing experience. And everybody else agree with the idea that of putting this the second paragraph at the beginning of the whole definition section?
This is Lee. I do.
The last part, though, about a clinical social worker will assist a client, that wouldn't apply to all three levels. So should that be in the kind of overall definition at the beginning? Or should that be added into the clinical social work definition as a separate paragraph?
Um,
Well, we could just say a social worker, because while not all levels treat mental disorders, they do help them identify factors that need to be addressed to try to solve whatever their problem is. And that could include any of these modalities. So if I just took out clinical and just say a social worker does that work for an introductory paragraph to the definition of social work on the website? Which may include, so yeah, it's not saying every social worker would do all of those things.
I would think so, since you put in that an LBSW cannot do this and an LMSW can under supervision.
Yeah, okay. Okay, what about DSW PhD? What else should we say about that level of social work practice? There's not a separate level of licensure.
I have a technical thing. So having a DSW or PhD does not technically allow them to call themselves a social worker in Kansas, because it's protected. So you might say who had or PhD is social work.
Oh, that's a good thing, Leslie. I wonder if we should go back and add that to the other ones. When you can and can't identify yourself as a social worker.
And maybe that's
Or add it to the overall definition.
right, exactly, because that applies to all levels.
Yeah.
I was just thinking on the DSW PhD, I don't even know if it's necessary because it's not a separate level of practice. And that's what the BSRB doesn't necessarily regulate DSW or PhD level, education. I mean, that's frankly all it is education. Licensure stops at the clinical specialist.
I would agree with Eric. I think it's a little confusing.
So I'm just thinking about someone in the community that is looking to understand, okay, here's this person that has a DSW or a PhD, and assuming that means that, they are more highly qualified to perform whatever service. And
But all
in reality,
DSWs or PhDs would still say LSCSW after it. There's not like the LP for psychologists that go from the LCP
Right.
to the LP. So
yeah,
the credential, while the PhD indicates higher education, it doesn't indicate
indicate
higher
higher
licensure,
licensure,
whereas
right?
like the others do. And I think the only one that even has a PhD level that the others can't achieve is psychology. I could be wrong.
You mean the only level of licensure at the doctoral level?
Right.
Psychology. Yeah, I think you're right. So just omit this whole section.
Well,
I
we
don't
don't.
necessarily think it's, oh, I was just saying, I don't think it's necessarily bad info. I just don't know that it's necessary for, we're talking about licensure here, and that doesn't affect licensure.
Like, because we don't offer it, so.
Yeah. Okay. Everybody okay with just leaving out any description of DSW PhD social workers?
Yeah, I am.
Okay.
Because we don't offer it.
Well, I mean, people can get a PhD or DSW, but it doesn't, yeah, there's no differentiation in our licensure. Or even as the sentence about saying that there is no separate, well, I guess that wouldn't really matter to a consumer to know that. So what we want is to add a paragraph at the beginning about the title protection. You must be licensed at one of these levels to call yourself a social worker.
Yeah, that would work.
So I'm just going to call it the intro, but you wouldn't necessarily have that in the document. I guess, do we say to practice social work or to call yourself a social worker? Because there are other jobs that where the job duties are probably social work, but they aren't called social worker jobs.
I would just say to identify yourself as a social worker.
And then after that, the 3 levels, bachelor, master's, clinical. Does that cover it? Is that what you were? Go ahead.
I think it's covering it.
Is that what you were thinking, Andrea? Oh, you might have lost
Yes,
her.
sorry.
Oh, no, okay, she's there. Okay. Okay, so Dave, can you guys put all that together in one and send it out to us?
Yeah, I would be happy to do that. If you don't mind, if you could send me this copy of your language, I have the other 2 sections, and I could just add it to that. And Leslie and I could revisit sort of some of the language we talked about for the second part, and then we could send it out to everybody so everybody could take a look.
Yeah, and I'm going to just put here also that this second paragraph would be part of the intro, along with the statement about needing to be licensed to call yourself a social worker. So then the clinical social worker part would be just the first paragraph and that last paragraph about clinical social workers perform services.
How important this is, but I was just thinking about, and you may have already stated it. Should it say something to the effect that you must have graduated from an accredited program? I mean, I don't see anything in there about education, but
I don't think so because we have an alternate path. If they don't have a CSWE accredited program, we can review their education.
okay.
Yeah, they have to have graduated from a program, and if it's accredited, then it's kind of automatically accepted. But if it's not, it has to go through this assessment process to make sure that it meets all the criteria. And that's in the the license information that's also on the licensing
Right.
information that's also on the website. I did want to well, I was going to include it in the in our CS Clinical Social Work Supervision Manual, the document that David created for us that shows the pathway to licensure, all the steps that you have to do, and graduating is from a master's or whatever level, bachelor's, master's program in social work is on that list, that pathway. So that'll be available on the website as well, both separately and I think within our CSW supervision manual.
And I do want to give credit to my staff members. That is a task that I outsourced to them because they're much more familiar with helping people throughout those steps. And so they put that together, but I think they look really great. So
They did a great job. Yeah, it's so helpful. And as we talked about all the bottlenecks and the choke points for getting people licensed, that really helps illustrate it very clearly. And I hope that could get passed to the educators that attended the forum and whoever else is on your distribution list, because I think it's that they need to be teaching that from the beginning. These are the steps you're going to need to go through, and you can start preparing for that now. Okay, great. Well, I think these three options will be a good representation of social work for people who want to come to the website and try and understand the difference. And I think we all deserve credit because we did not put in any of these that clinical social or that social work is the best. We know it is. Okay. Yeah, I'll get this sent to you, David.
I agree with Cynthia. Thank you for all of the hard work on this, everyone. So
Yeah.
really appreciate it.
Okay, I'm going to stop sharing. Where am I here? Oop. Okay, there we are. Okay, we're back. All right. Then the next thing on the agenda was our continued review and update for the social work supervision manual. And Eric and I have been working on that. And it's about ready. I do want to add this. I'll send it to you, Eric, so you can take a look at it before we add it to the manual. But can you put that up for people? Do you have that, the clinical supervision, or the clinical licensure path? Can you put that document up for this committee?
Yeah, let me
I
go
don't
ahead.
have it. I don't have it on this computer. So I can't.
No, I was asking David about putting
Oh.
up this path to licensure document that they gave us yesterday at our board meeting.
Yes, let me go ahead and pull that up. Okay, I'll try to make it big enough here. Let me know if I need to resize the screen at all. But
Okay. It's 2-page, yeah.
so here
Oh.
is this big enough for everyone?
Yeah, it's plenty big. Thank you.
So we basically ask staff members to kind of put together, for most of these, they're 2 pages. But you start on the left and work to the right. And it kind of starts with what's asked of the applicant and then all the steps that they go through.
Yeah, I mean,
And then you have basically the next steps by the staff members, and then different things along the way that if there is an issue, kind of some of the follow-up that staff members do, and then next steps there. And then back to the applicant in terms of other things that they are asked to submit. Make sure that we all have accounted for. There's also the educational review that the staff members do. There is the examination requirement. And then ultimately, once everything is fulfilled, except for payment of the license fee, there is the request for payment of the original license fee, and then how that works. So this is kind of what we had, staff had outlined in terms of the path to licensure, and this is the clinical example, but there were others for the non-clinical, and then there were some for individuals who apply through reciprocity, which means that you're licensed in another state and you're applying to Kansas either because you're moving or because you are adding a license type.
Mhm. And I would like to add to, under step 5 examination, that this approval to take the exam is good for 1 year, because I was very surprised to hear that there were people who got approved for the exam and then delayed and delayed and delayed until it was the 11th month. And then they're trying to hurry up and take it and get their results immediately. But I think it's important for people to know you've got you do have a time limit on when you can take the exam. Otherwise, you got to start all over. And I think so I think this is especially important to include in our clinical supervision manual, because I think that the supervisor should make sure that the supervisee is aware of this whole path, that at the very beginning of their 2 years plus of supervision, that this is what's going to happen at the end, and we need to make sure and cover all of these requirements.
And I added something else that has come up recently. I mean, for your manual.
Yes.
People are, Tyler is starting to send out an additional attachment to the approval letter when someone gets their training plan approved, that says, until you are clinically licensed, you have to practice under supervision and or direction. You can't, just because you finished your hours or passed your exam, doesn't mean you can practice independently. Because people are having, we've had some things come up, and I think that would be a very good addition.
We do have that in there, actually.
Okay.
Yeah, because we're aware of some of the, I know of somebody that, finished the hours and couldn't pass the exam, took it 2 or 3 times and couldn't pass it, and had to continue to be supervised.
Right.
And until such time as, and indefinitely until such time as she was clinically licensed.
Right.
So, yeah, thank you. We will make sure that's included. Eric, do you want to share anything about what we've come up with on the supervision manual?
Not necessarily. I think this just we're trying to be as comprehensive as possible without being overly, providing too much information, because we wanted to leave enough room for the supervisors to be able to still supervise independently and not try to recommend how they do supervision. But we did throw in some tips and some things that we found that work for us. So aside
Yes.
from that, I think that's I think that you've reviewed it pretty well.
One thing that we have added that was not in the manual before is a kind of a timeline for a supervision process, the whole process from start to finish. And it includes some of the information on that form that we were just looking at, but we wanted to give the arc of the whole experience, including some examples of the types of things that you would cover in supervision, that you might talk about, the topics, et cetera. And also emphasizing, again, where some of the choke points come, like, for example, supervisor and supervisee not keeping their logs and not reconciling their logs, because both have to submit a log of their time, and also the top, what you talked about in the sessions and that sort of thing. And so making sure that supervisor and supervisee reconcile those regularly is a way to make sure come time to actually apply for licensure, it'll be smooth going. It sounded like from a lot of what we were hearing yesterday and have heard in previous meetings, that a whole lot of the holdup in people getting licensed ends up being on the applicant's end of not submitting a complete application and or not being able to get information from their educational institutions or their references. So that's going to be an ongoing issues, but we want to make sure and that supervisors are aware of what they can do to try to streamline it and make sure that their supervisee will be able to get licensed promptly when they finally get their hours together. So we'll have a kind of a final draft of that for you for our next meeting. Okay. Now we were going to move on to our review and discussion on the ASWB Model Social Work Practice Act. And I think at our last meeting, we were asked to read the first 20 pages for this meeting. And I think the idea was we wanted to compare our Practice Act to this Model Act. David, wasn't that the intention? To see if there was anything in the Model Act that we might want to advocate for adding or changing in our act.
That's exactly right. This is a resource the Association of Social Work Boards has put together. They originally had a task force on this back in, I think, 1996 was the original one they had worked on. And then there have been amendments and changes in 2012, 2015, 2018. So it has been a fluid document that has changed, but the goal is to help provide a resource to states to give them something to examine in comparison to their statutes. And then if something looks like it would be beneficial, to add to the statutes for a particular state, whether it's language or whether it's a new item, it could be something to be brought over and requested in terms of a statutory change.
So do we have the ability to put up our Practice Act next to the Model Practice Act section by section?
That might be a little tricky, but I could definitely pull up the Model Practice Act and just kind of go through what's included in the first 20 pages and see if anyone had thoughts about any of the items in here compared to what we have in our statute.
Okay. You probably have the more encyclopedic knowledge of what's in our act.
That's probably more Leslie.
I don't. I have to admit, I do not have it memorized.
Neither do I, for sure. Although Leslie will surprise you. She will know numbers for regulations and statutes, and it's really impressive. But this is the ASWB Model Social Work Practice Act. We ask people to look at the first 20 pages or so. There is just a little bit of preamble there that talks about the purpose of having a Model Practice Act and what ASWB was trying to accomplish in providing this as a resource. And then kind of going through this, they do have a title, which we do as well in our statutes. They have something that has more of a declaration in terms of social work as a method of serving individuals. And so there is a description there in a statement of purpose in terms of the purpose for licensing and regulation of social work as a profession. There's also different sections that next focus on the different levels of social work license.
Mhm.
So there is a description in here about bachelor's social work, followed by master's, followed by clinical. I'm curious if anyone had any thoughts about some of the language from the Model Practice Act for the 3 levels of profession in terms of the LBSW, the Masters of Social Work, or the clinical language.
I did like the addition of the phrase professional use of self. As far as what I understand about our work, I wonder though about if that would make any sense to if what we're putting on the website is for consumers, would they know what that means?
Well, and I think it's kind of 2 separate topics. There's the language that we just were discussing that would be sort of a general description of the profession. I think kind of this focus might be something more that would change the actual statute or the law. And so, and that technical language may not be as applicable for the members of the public,
Right.
but relevant because those are linked on our website, so any person can review those.
Mhm.
There's some language here that talks about electronic social work services a little bit. That's kind of interesting. We don't have a section specifically talking about that, but a lot of our statutes were drafted, years before that was as common as it is today.
Right.
We do have, maybe it's in the regs, not the statute, did we added about the people having to have their 50% of their coursework in residence, but we redefined in residence to allow synchronous electronic.
Yes, you do.
And for
But-
social work, that's for the people who attend the non-accredited programs. The individuals who are also in candidacy for accreditation, they don't have to meet the in-residence definition either. But that is something that's an alternative to the traditional pathway.
So we have that, at least that reference to
Yeah,
electronic learning.
that synchronous and real time, that is part of what's been updated. Yeah. There are some definitions and different terms. We do have definitions in our statutes for each of the professions. There's a few more here than we have in our statute, but that doesn't mean we need to add any of them. Just wanted to point that out. We also have, this is written as the statutes, but we have sort of a blend between, we have the statutes that provide the broader statutory authority and the regulations that cover some of these topics too. So in here, they're all through the lens of the statutes, but sometimes ours, there is language authorizing us to do something in statute, but maybe not as detailed as the Model Practice Act.
Yeah, this looks pretty detailed.
The next section talked about the Board of Social Work. And some of this is a little bit outside of our control unless the bill goes through, but it did talk a little bit about the membership of individuals who serve on a social work board and some of the responsibilities of board members. There is a statute that does name which professions serve as board members and how many public members. There is some language that is similar to what we have in our statutes as far as being resident of the state. Now, this says being licensed and in good standing to practice social work in the state. Ours is a little broader. It really just says, you know, two board members must be social workers. This actually had a practice requirement in terms of the model language. There's some language there about public members. Language there about appointments, terms of office. So some of that is, you know, generally under the governor's authority, even though it's not a statute. So some language about filling vacancies, removal from serving on the board. There is a section here that talks about the organization. Compensation of board members and meetings. So some of this is a bit more, you know, technical in terms of the structure, and then employees and rules, but power and responsibility. So a lot of this may not be the most applicable to the advisory committee, but in terms of what individuals did review, in terms of the descriptions of the different levels of licensing, and then some of the general language concerning the board, did any advisory committees have any thoughts about anything stick out to you that you thought looked really helpful in some of this model language? Or if not, that's okay too, but just kind of wanted to open it up. I think from periodically, from time to time, it's important for us to review documents like this to look to see if there's anything that we are missing from our statutes that would be helpful to have added. This talks about legal services from the Attorney General. We get legal services through private legal counsel. There's some differences there.
Well, my overall impression is that our act is substantially similar to what this first 20 pages. Yes. Do you see any major differences?
With the exception of the language about electronic social work. There's not a lot of detail about that in our statute, but aside from that, and I'm not sure that we have as much detail about the levels of license, but that's not necessarily a problem. It just seemed like this had a little bit more detail concerning bachelor's, master's, and clinical than what our statutes have. But like I said, not sure that means we need to change anything. Just that's one of the things I noticed.
Yeah, I think that the definitions we have are operational. We have. Leslie, do you see any issue with the definitions of the different levels having caused any problems with needing more things more clearly defined than what we have in our current statute?
No, actually, I was thinking that the definition that you've written, that you just got finished going over, will be helpful. We do get a lot of calls from people asking what LBSWs can do.
Oh, okay.
And not being a social worker, I don't have a lot of answers for that. I have what the statute says, but it's not very clear on, you know, like it lists the case management and stuff like that. So I think the definition, that will help a lot. I don't know that there's anything in the statutes that's
needs to change. Okay. Yeah. Anyone else have any comments or thoughts about anything that we might need to take from that practice act and advocate for adding to our own?
I can tell you the next 20 pages, so going from page 21 to 40, focuses on licensing. So that might be a little bit more relevant to some of your work as advisory committee members. So if there's no comments today, we could ask you to go ahead and just review the next 20 pages, 21 through 40, and then just share any thoughts you have at the next meeting. That would be helpful for us.
Okay, that sounds good. Let's plan on that. 21 through 40. Okay, moving on to new business. The first order of business was updates from the board's out-of-town planning meetings. I think you covered that pretty thoroughly for us in your report, David. So I think we can move on to the New Brunswick social work technician information. We've been talking about if we were going to revive the AA level of social work licensure, and what could an AA level licensed social worker, what kind of tasks would they do, or would they be qualified to do? And I think this information gives us some ideas about that.
Yes, I agree. So I have brought this topic up at a couple of the different forums that I go to and talk to executive directors from other states or territories in some cases. And while they may not use the exact same terminology that we do, they did mention one of my colleagues from New Brunswick mentioned that they have a new social work technician that sounded very similar to an associate level type position. And she said they have a pretty good scope of practice defined in a document. And so he went ahead and sent that to me, and I forwarded it to you.
Mhm.
So I just wanted to hear kind of if you have any thoughts about that model that was introduced to New Brunswick. And I also asked Leslie to take a look at that document as well to share any thoughts that she had. We don't want to just create a level of license that would require people have a license for things that they're able to do right now, that they're already out there in the field. It does create a new pathway for people to get into a profession. That's helpful. So do you have any thoughts about the document from New Brunswick?
Are you asking Leslie?
I'll go ahead and open it up.
Okay. Yeah.
Yeah.
And can you put the document up for us?
Sure. It's about 27 pages long. So if there's any particular page that you'd like to take a look at, I'll go ahead and share it here. So this is something that is relatively new. The board of directors in New Brunswick adopted it back in December of 2023. The policy has only been in effect since about June of 2024. So there's really not a long track record of this. But it does go into the scope of practice of what these individuals can do as social work technicians. And so there is some information there as far as the scope of practice document. See if I can make that a little bit bigger.
Yeah, there we go.
I reviewed the scope of practice. I just think it's so similar to the BSW. Not really seeing too much of a difference other than, I guess, the
So
education. I don't know.
is that the main difference, David, that they only have to have an AA degree or so many hours?
And I have not fully delved into this document yet. There are some issues in terms of some of the funding streams that are available right now for our bachelor's level social work license. There are some programs out there that could potentially receive funding for a 2-year terminal social work license. Some of the community colleges are able to get certain funding, but the way that they're set up for some of these scholarships is they can get money for people to do something if it is a 2-year type degree versus a 4-year type degree. And it can't be like a bridge. It can't be something where it is 2 years towards a 4-year type degree. So potentially if there was something that would be 2 years, but if it's a bachelor's level license, then that would be a little bit different. But the way that this had been described to me, at least from a very high level, was that the technician was something that was lower than an LBSW.
Well, the description you've got up right now is, I, it's very broad. Hands-on intervention aimed at improving social well-being to allow clients to reach optimal social functioning. But what does that look like? Does that mean they're doing scripted groups? It's not very clear what it does say here that they have college level education, but it doesn't even say a degree. Whereas social workers have a university level education in social work with a minimum education of a BSW. So obviously there's the educational differences, like Yolando said, but it's not so far anyway, that we're only a few pages in here, but do they give some more specific examples of what text can do? Okay,
I
here
was
we go.
gonna say there was
There.
that page.
Yeah, that's the one we were looking for. But again, it's a general, they're categorized as paraprofessionals.
If you scroll down more, there's kind of a, I don't know, like a grid or whatever that has specific things that what they can do, some on their own, some with oversight. It's page 17.
And the
Page
way I
16.
kind of read, let's say the way that I kind of read
Here's the
through
scope.
this is that this is essentially a position that could be filled by the same folks that have bachelors of social work but never licensed. So that's sort of what this feels like, is it would be a something that could fill that role of people that can't pass the test or haven't passed the test but do social work style jobs, is sort of how I interpreted this.
Okay, here's okay, this is good. This shows more of the specifics. Crisis intervention services, assisting other professionals, but it doesn't say how.
There's a paragraph that says the technicians have a technician level understanding, where the social workers are responsible for conducting and interpreting assessments. Social work technicians are responsible for working closely with clients to support them through the course of action determined by this professional social worker. They're specially trained to work closely with clients and support them through a range of hands-on interventions. But again, no specific.
No specific example, right?
But I think
Um,
that's going back to what Eric said,
Mhm.
because you could be a support worker, and usually support workers work with licensed social workers, and they do they do the plan of care or the treatment plan, and they may have a degree in psychology, in sociology, or any other thing other than the social worker. Or they may not be licensed.
Yeah, I'm sensitive to the idea of not trying to create the requirement for licensure for activities that are currently being provided by people that don't have to be licensed. But there's also that a way of inviting people into the profession, which has been the point of those temporary student licenses for the addictions counselors, is for
One,
you create a pathway to invite them into the profession, to kind of sweep them in early, and help them have a vision of themselves as. And so in that way, this level of a job, if it were called a social work tech, could serve in that function. There's
so I
Go
was
ahead.
going to say, like David, I haven't done an exhaustive review of this document, but one thing that I didn't necessarily see is that this level requires a exam, which when we talked about the exam being a hurdle that some people can't overcome, some of those positions that are unlicensed, this might be a step towards that for them to have the associate level, at least they would have some recognition of, their work. I don't know.
Yeah, to be able to say they're a licensed social work tech might feel, but do we think there should be an exam though, if we're for any level of licensure?
So if this was filtered through more of an associate type approach, kind of to what used to exist, there is still an associate level examination that ASWB offers. It's not a lot of people take that exam, but it does still exist. But
I don't think it was ever required in our statute. 'Cause I had my first license was in AA because I had a bachelor's in criminal justice, not social work. And I didn't have to take an exam to get that designation back then. But I don't know if, I know we still have that level of licensure exists, but we haven't licensed anybody as an associate social worker for how many years?
at least 44. Yeah, when the BSRB was created back in 1980, some of the statutory language said individuals that held that level of license could continue to renew it, but the now BSRB would not be able to issue any new licenses at the associate level.
Mhm.
We're down to 4 people who hold the associate level license.
Mhm.
Well, I wanted to provide this as a resource. We talked sort of with a lot of hypotheticals as far as if we wanted to try to develop the associate level license or bring it back. And if we did, what would it look like? One of the
This
nice
is an
things about
example.
this, it does give sort of a way to see what at least one province is using as an option that we don't currently have here. So not to say that we need to hold this model, but it is nice to actually see something tangible that we could pass around and have people take a look at.
So this, it feels a little like KVC used to have they were intensive programming where they would have an LSCSW who was doing the actual clinical work, but they would have a partner who, I believe they were bachelor's, they might have had to be bachelor's level people, but they would do things like, transportation. They would attend home visits with the clinician, not necessarily the sessions with the clinical sessions, but the other visits. And so, yeah, kind of like an aide and someone else who was very well versed in the family situation, knew all the players, etc. And but I think though that role was a bachelor's level social worker, if I remember correctly. So anyone have any thoughts about does looking at this example make us think we want to try and develop that kind of a level of licensure in Kansas? Doesn't seem like it's hugely inspired us to do that.
I personally still don't see the point of the associate level, but if it has an exam. Now, if you remove the exam piece, I think there could be a niche that it could fill. But if there's still the exam, I think to me, it doesn't have a lot of value.
What do paraprofessionals in schools have to take an exam? Do we know? No, they don't. Okay.
I don't think so.
Mhm.
Maybe if they were working under someone that is licensed.
Mhm.
I was just going to say the paras in our schools around here, I think they just have to pass a background check.
And they have to have a high school education, I
High
believe.
school. Yeah. Well, diploma or GED. Yeah. Well, if anybody has any further thoughts about that or ideas about what a tech level or associate level social worker might bring to the table in terms of duties and responsibilities that they could fill that would be supportive of clients and their needs. Maybe working alongside a higher level license, and then let us know. You can email me, or if you have thoughts in between now and our next meeting. And David, if you learn of any other examples that we could look at, I would be interested in seeing other possibilities.
Gotta do a little more research.
Okay. All right. We're almost at the end of our time. So I don't, well, I don't know. I don't know if we want to get started on reviewing these 3 reports. We might be able to talk about one of them. Would you all rather wait and do that whole piece at our next meeting? These are the first 3 reports from the ASW exam reports on a profile of social work license examinees, determinants of licensing exam outcomes, and the effects of race and ethnicity on clinical exam outcomes.
I would say, this is Mike, I'd like to see us wait. When
Okay.
I looked at it, it was so exhaustive. I was looking for the abstract. Where's the abstract? Give me the summary. But there's a lot there.
It is a lot. And I think there was a summary at the very beginning of each of those reports, but and there, to me, there was a lot of overlap between the 3 of them as well. And what they did not do was really evidence what was causing the discrepancies. They give several variables, but and maybe we should just review why we even want to look at these reports, and that's that the ASWB did report data that showed that there were large discrepancies in the outcomes of the test, the exams, that between racial groups and also age, older test takers.
Right.
So they have now since then been doing further research to try to drill down to what is the reason for that and how can that be corrected. And they have in the interim put in place a number of measures. They have a program for people who fail the exam that they can refer them to, that provides one-on-one assistance and additional materials. For a while, they were making the study materials available to, I believe, to the universities. Was that right, David?
I
To
believe so.
help them help their students prepare for the exam. So they have some interim measures in place, and then they're continuing to collect data and do this research to try to address this problem. So that's why these 3 first reports exist. And I agree, Mike, I think it would be wise for us to delay that review of these until next time, but I do encourage everybody to read through them. Go ahead.
I would also like to mention that we had people from the SWV speak to us to try to answer some of our questions. I don't know if
Yes,
that was a year ago, and that was very helpful because
it was.
they didn't try to say we're ignoring it, but
Mhm.
they also said they were going to look at using 3 answers, options for the answers rather than 4,
Correct.
and different things like that.
Mhm.
And I didn't see, we're not talking in detail about those analysis, but it what I looked at did not reflect the changes or the things that they had mentioned to
Right.
us.
Yeah, I'm not
So
sure that they have that data yet to compare, since
So
they've made.
that was my question. Is this the data that started this thing, this questioning 2 years ago, or is this the data that now they've gathered some new data and these are these reports? But
Yeah,
when I looked at the who did it, it was a third party. It wasn't the ASWB. It was a third party. So I didn't get a good sense of what the reports were even to start with, but I got to look at them closer before I can.
Yes, I think they do take some drilling down to really be able to grasp everything that they're telling you, and also what it doesn't, what they aren't saying, you know, or what the data isn't proving or evidencing. So, does anyone disagree with carrying this topic forward to our next meeting? Okay. All right. Well, I think we are about at time. So I thank you all for your time and for being a part of the advisory committee. And I will look forward to seeing you at our next meeting, which will be on Tuesday, December 10th at 10 a.m. So we'll wish each other a happy holidays at that
Happy
time.
holidays.
Okay.
Bye.
Everybody
Well,
have a good
so
rest of your day.
So
Thanks.
moved. I don't know if we have to close it, but anyway, have a good day.
Take care. Bye-bye.
All right.
Thank
Thanks,
you.
everyone.